Thank you for participating in Long Beach CHDP's online Developmental Evaluation training. Before we begin, it is recommended that you obtain a copy of the Socio-Emotional Checklist and the Developmental Milestones Checklist to refer to later in the training module. The URL, links to the checklists found on the Long Beach CHDP website are provided to you here. The goals of this module are to ensure that participants understand the importance of routine developmental evaluation, know when to screen a child for developmental delay, can demonstrate the ability to determine whether a child might be developmentally delayed, are familiar with the referral, treatment, and follow-up for a child at risk of developmental delay, and are familiar with CHDP reimbursement and PM160 documentation of developmental evaluation, referral, and treatment. Why is developmental evaluation so important? The CHDP Health Assessment Guidelines assert that routine developmental evaluation can help identify problems early so that additional comprehensive or focused assessments and intervention can be initiated. For most cases of developmental delay, early intervention maximizes the chances of improved outcomes, such as language and communication development, cognitive abilities, and social-emotional skills. Additionally, delayed or disordered development may indicate an increased risk of behavioral disorders or associated developmental disorders. Developmental delay could also be caused by specific medical conditions and may indicate an increased risk of other medical complications. In any case, prompt identification of any problems can spur specific and appropriate therapeutic interventions. In order to catch problems early, help from pediatric healthcare providers like you is critical. Since you, as a healthcare professional, have regular contact with children before they reach school age, you can work with parents and caregivers to identify any areas of concern and educate them on any necessary follow-up. A structure for conducting these evaluations is very important because some problems may not be blatantly apparent, such as depression or anxiety. A careful review of a child's developmental and behavioral functioning is necessary at each well-child encounter. Are you convinced? Good. This next section will give you the skills and tools you need to effectively evaluate your pediatric patients for any developmental delays. First, let's go over who should be screened for what and when. When evaluating young children up to age 5, you should make sure to assess their gross motor development, including their strength, balance, and locomotion, or their ability to move from one place to another, as well as their hand-eye coordination. You should check that they have age-appropriate communication skills, including expression, comprehension, and speech articulation. You should also ask caregivers about the child's ability to engage in social interaction with other children, adolescents, parents, and adults, and about their problem-solving or reasoning skills. School-aged children between 6 and 10 years should be evaluated for their visual motor integration, like the ability to kick a soccer ball as they see it rolling towards them. Visual spatial organization, which includes skills such as reading and interpreting a graph or imagining 3 dimensions, and visual sequential memory, which is the ability to recall the order and details of things seen in the past. This age group commonly has difficulty with paying attention and auditory processing, so keep an eye out for anything abnormal. You should also consider the presence of learning disabilities, peer relationships, and psychological or psychiatric problems. In addition to all the concern of the school-age child, you should also consider an adolescent's emotional well-being and their ability to build healthy relationships. This is the time to inquire about any exposure to substance abuse or potential violence. You might also decide to talk to the teen about developing vocational skills. According to the CHDP Health Assessment Guidelines, you should be screening patients for developmental abnormalities at 9 months, 18 months, and once between 2 and 3 years. However, it's required that you conduct a psychosocial behavioral assessment and developmental surveillance at every well-child visit. Well, what's the difference between screening and surveillance? Developmental surveillance is the ongoing process of recognizing those who may be at risk of developmental delays. As with other types of evaluations, it should be age-appropriate and culturally sensitive. You should consider the child's socio-emotional and behavioral history and compare the child's development over time. Every well-child visit should include surveillance that elicits and attends to parents' or caregivers' concerns about their child's development. This should be documented with the child's developmental history. During surveillance, you will make observations of the child in order to identify potential concerns and will maintain an accurate record of any findings. A developmental screening uses standardized tools, such as the Ages and Stages questionnaire or the Parent's Evaluation of Developmental Status, or the PEDS survey. Remember, while surveillance must occur at every well-child visit, a screening need only occur at 9 months, 18 months, and 2 to 3 years, or as indicated by outcomes of developmental surveillance. Additionally, while parents and caregivers should be prompted to elicit any concerns they have during routine surveillance, during a screening, the screener should encourage conversation and provide a more in-depth discussion, including anticipatory guidance appropriate for the child's age. Ready to get started? This next module will teach you how to conduct developmental surveillance. If you haven't done so already, you should obtain a copy of the Socio-Emotional Checklist and the Developmental Milestones Checklist, both of which will be used every time you conduct developmental surveillance. There are a few things that you should keep in mind while surveying a child's development. First, many children will behave differently in an exam room than they do at home. They may be nervous or unsure of their environment, which can result in shy, introverted behavior, or hyperactivity and misbehavior. This is one reason why conversing with the parent or caregiver about the child's behavior in normal settings is very important to an accurate surveillance. Second, there are many cultural differences regarding the proper way to rear a child. This is something that you already must assess and adjust to during each well-child visit. Sensitivity, understanding, and communication are key skills to overcoming the barriers potentially raised by cultural differences. Finally, keep in mind that our socio-emotional health is strongly connected with our physical health. A physically ill child might be more at risk for certain socio-emotional concerns, and of course the opposite can be true. A socio-emotional, developmentally delayed child is at higher risk for physical health concerns. Including the importance of proper nutrition and exercise in your developmental anticipatory guidance can help break up this cycle. Developed by the Long Beach CHDP administration, the Socio-Emotional Checklist is based on the PEDS Developmental Survey. The checklist can be filled out by a parent or caregiver while in the waiting room before an exam. Older children should fill out their own checklist, in addition to their parents. As children mature, their parents may be less in tune with their child's emotional status. Respect the older child's privacy. They may not feel comfortable sharing some of this information in front of their parents. You may be the only adult they feel comfortable sharing their challenges with. This is a good time to provide the parent or caregiver with an age-appropriate copy of the Bright Futures handout included in this module. This way, they can review the material before getting a chance to discuss any concerns with the provider during the exam. We will discuss the Bright Futures handouts later in this module. The Age-Specific Developmental Milestones Checklist is based on the developmental milestones listed in Table 54.1 of the CHDP Health Assessment Guidelines. For this document, you will first fill out the patient information section and the risk factors section. This section only has to be filled out during the child's first visit to your office. You may wish to have the parent complete this section in the waiting room before the exam. The next step is to assess age-specific milestones. This is done by observing the child's behavior throughout the exam and also by conversing with the parent or caregiver. This discussion should include going over the activities to promote development found in the middle column on the checklist. The Bright Futures handouts complement this checklist. You should incorporate themes into your anticipatory guidance. During your assessment, should you identify any concerns via the checklist or in conversation with the parent or caregiver, you are encouraged to sensitively discuss your concerns with the parent or caregiver. As mentioned earlier in this module, you as a healthcare professional are in a unique position to express developmental concerns to a parent or caregiver who might be apprehensive about considering any type of delay or abnormality. As a reminder, be sensitive to any potential cultural differences. This can often be a sensitive subject for parents. Some children may require further testing, treatment, or referral. CHDP includes many resources on the referral guide located at www.longbeach.gov/CHDP. The Bright Futures handouts, What to Expect and When to Seek Help, provide age-specific social and emotional information and can help guide and inform anticipatory guidance, as well as developmental tools for parents and providers. The brochures are divided up into 5 handouts: birth to 12 months, 1 to 4 years, 5 to 10 years, 11 to 21 years, and a 5th packet with worksheets to help you create a referral network in your area. Long Beach CHDP has already developed a referral guide located on our website. However, you may wish to create a list of your own providers. Why should you provide anticipatory guidance on child development? Besides being a trusted source of health information for parents, caretakers, and patients, it is very important for you to support the role of parents and caretakers in a child's development. Studies have shown that children do better if they have secure emotional ties with a parent or relative, as well as relationships with friends and mentors outside of the family circle. Additionally, it's important that caretakers understand the process of child development. Unfortunately, child abuse can be a result of the caretaker's misunderstanding of developmental milestones. You can equip the responsible adult with the information they need to foster their child's socio-emotional development and recognize any problems as soon as they first present. As a reminder, you should conduct a complete developmental screening at 9 months, 18 months, 2 to 3 years, and as indicated by surveillance or when there are concerns about the child's motor or behavioral development, growth patterns, or other possible issues such as autism. CHDP has a list of approved developmental screening tools that are scientifically validated, culturally and linguistically sensitive, and offer reliable results. The chart in the Health Assessment Guidelines Appendix A offers a list of general and domain-specific screening tools, most of which are formatted as parent or caregiver completed questionnaires. The 4 tools recommended for periodic developmental screening at 9 months, 18 months, and 2 to 3 years are ASQ or ASQ3, the Ages and Stages Questionnaire, PEDS, the Parent's Evaluation of Developmental Status, which focuses on parents' concerns about their child, and PEDS-DM, or PEDS Developmental Milestones, which focuses on a child's age-specific skills. There are also approved screening tools for cases where surveillance reveals a need for further evaluation in any of the following categories: social, emotional, and behavioral, language and cognitive development, and motor skills. Finally, if you suspect a child might have autism spectrum disorder, the HAG recommends either the MCHAT, PDD-ST2, which stands for Pervasive Developmental Disorders Screening Test, or the SCQ, Social Communication Questionnaire. As with most developmental abnormalities, early identification increases the likelihood of successful treatment. The American Academy of Pediatrics recommends screening for ASD at 18 months and 24 months, or earlier if a sibling is on the spectrum or if there are parental concerns. Any concern in any developmental domain should be promptly addressed with standardized developmental screening tests, like the ones discussed, or with appropriate referral. California Code of Regulations Title 17 requires referral to an Early Start program within 2 days of identifying an individual under 3 years who might be in need of early intervention services. The Early Start program in Long Beach is located at Harbor Regional Center in Torrance. Their contact information can be found in the Early Start Central Directory of Early Intervention Resources, a comprehensive resource for parents, family members, service providers, and members of the public. You may also decide to contact the local school district's preschool special education program. The link to Long Beach Unified Special Education contact information is provided. Developmental surveillance is currently reimbursed as part of the history and physical exam to be performed at each complete well child visit. Keep in mind that results may guide necessary treatment or referrals. Developmental screening may be reimbursed by Medi-Cal. Now we'll go over how to fill out the PM160. In the CHDP assessment section of the PM160, locate row 5, Developmental Assessment. If there are no problems suspected, put a check in column A. Otherwise, use the appropriate follow-up code 1 through 6 in either column C for new problems or D for known problems. Make sure to offer an explanation in the Comments Problems section. Write the number 5, referring to the assessment procedure, your explanation, and then the applicable follow-up code. Finally, if you are referring a child to a specialist, write the referred to provider's name and telephone number in the referred to boxes above the comments or problems section. Remember to complete and submit the post-test in order to test your knowledge and obtain your certificate of completion.